A lot of researches are going on in MS. Why? Because the number of patients are fast escalating globally. In the same way, in our country also, like I wanted to tell you, in 2008, we had only one multiple sclerosis society in Delhi, whereas right now, each and every cities are having MS societies. And the number of patients in India is escalating since 2010. The reason may be lifestyle changes and many other things. The same way, in globally, the number of MS patients initially were 1 in 50,000 in European countries, but now it is less than 10,000 patients, one in every 10,000 is affected. So the number of patients in multiple sclerosis is fast escalating. For that reason, intense researches are going on to find a solution for multiple sclerosis. So MS, as it is occurring in a very younger age, one should be aware about that disease. MS can start with very milder symptoms like you have sensitivity problems. In the initial attacks itself, you can lose your vision partially or completely. You can have balancing problems. You can have walking difficulties, or you can even have bladder control be affected. So it can affect symptoms that makes you unable to work or pursue your family life, etc. So for that reason, MS needs to be attended at the very early time itself, because in the initial stage itself, study says that there are tremendous in a tremendous way, there is a neuronal damages happening in the central nervous system. So it should be treated as early as possible. Multiple sclerosis, unfortunately, it's not as an individual is not affected alone. It influences the whole family in a way, financially and also emotionally. Like if the father is affected, the income of the whole family, or the mother is affected, the income of the family can be affected. If the child is blinded or having a walking problem, then one has to treat it at least for 30 to 40 years. MS is known to be having the maximum chronicity and the maximum expenditure it requires. A study says in 2008 in Germany, an year in the initial phase of MS, the expenditure coming will be about 18,000 euro. And when the person is having debilitating symptoms like walking issues or bedridden, it can go up to 500,000 euros. So the expense is too much. Almost all the disease modifying medicine, that is what is called the DMDs used for multiple sclerosis, are highly priced. A single month you have to shell out about 50,000 rupees, and that can go up to few lakhs rupees. And there are newer medicines coming in to block your immune system or immune suppressant, what are costing per tablet costs 5,000 rupees, and a strip of 10 tablets costs 50,000. So the expenses are so high to treat a multiple sclerosis patient. Not to forget, if a person is affected at the age of 25, he may need treatment at least for 40-45 years, because his length or longevity of life is not reduced in this case. Why MS is serious means there are no known cure for MS, or there are no known medicine to stop the progression of multiple sclerosis in conventional medicine. So the focus of patients internationally is on a solution. So at this point, I wanted to tell you that Ayurveda gives a pathfinding change in the life of MS patients. So since 2001, we started a specialty center that focuses only on multiple sclerosis, And since then, globally from over 40 countries, we have patients coming on to Kerala to undergo the therapy. So we have formulated special formulas for MS, because since it is not only a neurodegenerative disease, it is also linked with your immune system, your hormonal functions. So you need to research and find new formulas and new medicines and new treatments in this context. We are conducting researches. We are collecting all the data, the scientific data required for substantiating the efficacy of Ayurvedic treatments in multiple sclerosis. So researches are in the pipeline. Recently, we have collaborations from US and also from neurologists from India itself. So a study will be conducting by the end of the year. That will be for about 2 years' time. A subject of about 50 patients will be selected who are taking Ayurvedic treatment and also who are taking conventional medicine. A comparative study will be done in this research program. So I think we will come up with a very promising result on that. So the question arises, what is the difference of approach to MS in Ayurveda in comparison to conventional medicine? Ayurveda consider that it is a immune mediated disorder, and it is causing degeneration or myelin sheath degeneration in your central nervous system. But to emphasize here, it is not an autoimmune disease according to Ayurveda. So Ayurveda, how it treats means, it treats the central nervous system where the degeneration is happening. Your walking, your vision, your bladder control, all are determined by your brain and spinal cord. And Ayurveda treats these, the central nervous system or your brain and spine. Ayurvedic herbs are having biomolecules that can cross the blood-brain barrier to treat these anomalies. And it parallelly treats also your immune system from rampant attacks or autoimmune process or immune mediated attacks will be controlled by herbal medicines and herbal treatments. So this is a diverse way in which MS is treated according to Ayurveda. 2001 onwards till 8, I was specialized in multiple sclerosis and I was treating MS in Germany. Then thereafter I shifted back to India in Kerala, and we started a MS specialty center here. And since 2008 we are here treating multiple sclerosis, or in the treatment of MS we need high quality medicines. Ayush Prana had dedicated 8,000 square foot of its pharmacy in GMP standards only for creating medicines for multiple sclerosis. One example I can tell you, the oil use, normally a 1:1 ratio of fresh herbs are required, but we uses about 5 to 6 times more extracts into these oils to make it more concentrated, and that is being used as a neuro healing medicine in the treatment of Shirovastis and many other treatments. These medicines are used. So you have to make hand-picked herbs, quality herbs, and you have to make treatment-oriented medicines for that in limited quantities. So that is one of the key element in the healing process of multiple sclerosis.